If you've never been tested for syphilis, the process might seem confusing. In this video, we'll explain exactly how testing works, what kind of sample is taken, which lab tests are used, and how the results are interpreted. Here's what to know. What kind of sample is used for a syphilis test? Syphilis testing, also referred to as RPR testing, starts with a simple blood draw, just one small tube. No swabs, no urine samples, just blood. That blood is then used for two types of tests. The first is a screening test. The most common one is RPR. These don't detect the bacteria directly. They detect antibodies created when your body reacts to cell damage. They're fast and affordable, but not very specific. A reactive result or positive result could be from an active syphilis infection or something else entirely. So if the screening test is reactive, a confirmation test comes next at no additional charge. This testing is CDC approved and accurate. So how fast are the results? Most syphilis tests come back in 1 to 3 business days. How do you interpret your results? If your test is reactive or positive, it means you'll need treatment and can schedule a call with one of our clinicians for a prescription. And if the result is non-reactive or negative, you likely don't have syphilis. But if exposure was recent, retesting in a few weeks may be smart. Lab Cafe is the fastest way to get tested for syphilis. Private, professional, and trusted. Need results quickly? Go to thelabcafe.com and book your test in minutes.